Hey everybody, Bob Brisky here, Vice President of Marketing over at Pinnacle Financial Services. I want to welcome everybody to our webinar presentation today. So today we're going to talk a little bit about what's been going on, not only in the Medicare Advantage space, but also how ancillary health products are going to be really critical for this upcoming year. We're going to keep it short today. It is going to be recorded. And I anticipate maybe 15 minutes or so, and then we can always follow up later with questions. All right, so the need for ancillary product sales in 2025. So as we know, the 2025 final rule is making some pretty significant changes to things with the Medicare Advantage plans. We've seen carriers already come out and say that their plan offerings are going to change, where they're going to have plans are going to change, so that so their footprints are going to decrease in many instances. The Inflation Reduction Act also has had significant impact on what's the costs are going to be for the Part D plans. And then, of course, if the Part D plans are going to be more expensive, that's going to impact the Medicare Advantage space as well. So we know that the Part D drug cap is going to go to $2,000. Which again is going to drive up costs to the insurance carriers. Items such as mandatory dental implants on Medicare Advantage plans, of course, is going to impact how the carriers structure their dental benefits on the upcoming 2025 plan. So a lot of disruption we're expecting. I know everybody probably doesn't want to hear this, but we do anticipate that agents will have to look at talking to their entire book of business in ways that they have not done in previous years. In previous years, you might have had a big book part of your book that you just told them, hey, you're good, stay where you are. But there's going to be a lot of disruption this year. We anticipate, of course, we have not seen the 2025 plans yet, so we're still holding on to that. So once we see those, we'll have a better idea of how significant the changes will be, but we know there are going to definitely be changes. All right, so need for ancillary products, Advantage plans, higher out-of-pocket costs. So we definitely anticipate that higher out-of-pocket costs in the 2025 plans. So the MOOPs, as with the maximum out-of-pocket, we anticipate to go up. We also anticipate that the co-insurance, the deductibles and co-payments are also going to go up. We may even see, which we haven't seen, and I'm not sure it's going to happen this year, but it could very well happen in subsequent years, premium on more Medicare Advantage plans, for example. So we're going to see a lot of shifts in these plans. So if Medicare Advantage plans are increasing copays and deductibles, we know that's going to have a significant impact in the out-of-pocket cost for the beneficiaries, right? So as independent insurance professionals, what do we need to be doing to make sure that our clients have the best possible coverage as possible? So again, we are going to have to talk to our clients differently this upcoming AEP than we have in previous years. This is really important to keep in mind. All right, so adding those ancillary plans. So we're going to look at other things to keep in mind. So just consider that such things as hospital copays. When I look at Advantage plans, it is different than traditional Medicare, the Medicare A and B when it comes to some of these things. So hospital indemnity plans is one really good example of how we can help our clients with the cost of hospital copays that are going to be part of Medicare Advantage plans. So we anticipate that we are going to have increased copays, and the hospital copays could be one of those areas where we see those increases. So instead of a $200 a day for a 3-day copay in an Advantage plans, maybe it's $400 for 5 days, right? So we could see those tweaks happening. So when you look at a hospital indemnity plan, maybe you don't cover the whole out of pocket for hospital, but maybe you're looking to offset some of those costs, and maybe you add a $200 a day hospital indemnity plan that will cover at least some of those out of pocket costs. So these are all things as an insurance agent that you want to make sure you're looking at now, right? You want to make sure that you have these plans in place so that when AEP comes around, pre-AEP, October 1st, as we call it, when you can really start talking to your clients, that you have these plans available, that you can start, really delving into these other options. All right, cancer treatments. We know that there's some really high out-of-pocket costs can be associated with cancer. Really, a lump sum cancer plan can be very inexpensive, virtually guaranteed issue in most cases. As long as you haven't had cancer, most cases it's 5 years. Some plans it's 10 years. These are pretty much otherwise guaranteed issue plans. So some of the options out there are pretty easy to get, regardless of other health instances, and it can be pretty inexpensive ways to cover these out-of-pocket cancer costs. And remember, these are separate from the Medicare plan. So these are plans that are going to pay in addition to any of the other health coverage that they have, such as a Medicare Advantage plan. So when you're getting these benefits paid to your clients, remember they can use those for many different things. Could be travel expenses to go to some of the cancer treatments that they have. Maybe they're in a rural area. Maybe they need to go to MD Anderson or the Cleveland Clinic or the Mayo Clinic or some of these other places. And some of these costs of things such as travel can really start also adding up. So just keep these things in mind. These cancer plans would be separate from their other health insurance and pay separately, but can really go a long way in helping clients with these costs, these out-of-pocket costs. All right, dental benefits. Another thing that we're going to take a look at. Remember, standalone Medicare Advantage plans many times have had pretty good dental benefits in there, but we are looking at some of these other benefits like dental, vision, hearing to really see some cuts in there. You might have to look at some of these standalone dental plans. There's some good ones out there. The team here at Pinnacle Financial can certainly talk to you about the different options available in your state, but really some brand names such as MetLife through the National Care Dental brand. You also have options such as Delta Dental, Cigna, another option. Some pretty good plan options out there that you can sell and offer to your clients in addition to the Advantage plans, for example. If you're selling them supplements, of course, they typically don't have dental plans in it, and that's just been the way it is. So these standalone dental plans can also be great add-ons to even the Medicare supplement clients. So keep that in mind. You want to take a look at these plans today and make sure that you have one in your bag that's going to be really good. Typically, these cover most ages. Typically, these are guaranteed issue plans. So easy add-ons. Traditionally, you can add these as part of your scope of appointment. Talk about it when you're talking about the Advantage or supplement plans that you're working with your clients. All right, existing clients, we talked a little bit about this. You're going to talk about, you're going to see these significant out-of-pocket changes is what we're anticipating. Again, shortly, we should be getting some of these first looks, as we call them, on the 2025 plans. We'll get a better idea on how significant these out-of-pocket changes are going to be. So you want to take a look at maybe having these standalone plans such as hospital indemnity, cancer, and dental available in your bag to be able to use with your clients as needed. All right, some of those plan options again: Guaranteed Trust Life or GTL, Cigna, Aetna, Delta Dental, National Care Dental. That is the MetLife plan. A lot of options. You can really personalize these plans for your clients. And again, typically guaranteed issue or just minimal underwriting. So most individuals are going to be able to get most of these plans. Again, some of the options are not going to be 100%, but pretty standard across all of these carriers. But again, you want to get your ducks in a row before you start meeting with your clients, right? Make sure you have the correct plans in your bag that you can sign up individuals after you're having these discussions. All right, what I like to call some Med-Sup Light, right? These are just some options that we're seeing. So if you're Medicare Advantage plans, if we see them having a premium in 2025, if you're going to add a hospital indemnity, you're going to add a dental, vision, and hearing. If you're going to add a hospital indemnity and a dental, vision, and hearing, you can see how the final rule changes, how the Inflation Reduction Act changes are going to impact your clients and the overall out-of-pocket exposure that they have. Even those with a Medicare supplement, keep in mind that a Medicare supplement could have changes this upcoming year. We are seeing some possibility of significant increases to the premiums for Medicare supplement. And then throw on top of that the changes in the premiums we're anticipating on a Part D plan, where the least expensive premium this past year was 50 cents a month. We're looking at that being more like $60 per month in the upcoming year. So is the MedSup with the Part D going to still be in the budget of individuals? Will they look at our quote unquote MedSup Lite option, which could include a Medicare Advantage, adding on a hospital indemnity, adding on a dental, vision, and hearing, adding on a cancer plan, adding on these extra ancillary plans, which again, you could package together to really put a good coverage option for your clients, even on the Medicare supplement side, where the pricing might be a little bit better than what they're going to have right now with a traditional Medicare supplement and a Part D plan. And again, we're going to see those prices coming out here shortly, but you want to make sure that you have all these options available to talk to your client. Really important that you, as the professional, have these options available, because if you're not talking about these options, I guarantee you, if there's a lot of benefit changes, if there's a lot of premium changes, your clients will be talking to someone about their options. All right, contracting commission. So remember, these ancillary plans are in addition to the hospital or the Medicare Advantage plans or your Medicare supplement plans. So you're looking at an additional commission on top of those traditional commissions that come along with Medicare Advantage, for example. So those could vary depending on the carrier that you're picking. So you got to talk to your Pinnacle financial representative, make sure that you have the right plan for not only your clients, but you know the commission structures for these different plans for you. Here's all the information. Contact your Pinnacle team today, 800-772-6881, dial extension 7731. Get right to the Pinnacle team. You can also email healthsales@pfsinsurance.com, and they can help you get set up with any of the carrier options that you need. But act now. I know it's June, and we're in AEP and pre-AEP. We're looking at October, but you want to have your ducks in a row prior to then. Right? Don't try and do your contracting on October 15th. The carriers are traditionally not quick, and it might really put you in a bad spot on getting set up to offer these options if you wait. So you want to hit the ground running, get set up now, contact your Pinnacle team. That's all we have for today. Again, any questions, reach out to your Pinnacle representative. Hope everybody has a great rest of your day, and we look forward to working with you this coming AEP. Thank you, everybody.
Don't forget to subscribe to catch the latest news in insurance and agent training. See you in the next video.